I will never vote for anyone who wants to destroy our health care system. I will never vote for anyone who wants to increase even more the debt that they're going to put on my children's shoulders by expanding Medicaid and Medicare to people who already have private health care, to people who earn $100,000 a year. They are trying to redistribute not just wealth, but authority in this country. Why in the world would we encourage people who have private health care to drop it and become government drones unless you're a socialist who is power hungry? Who the hell died and named Barack Obama and Joe Biden and Claire McCaskill? The dictators of the private sector. They talk about idiots. Well, the private sector didn't run up a $53 trillion debt. The private sector, no matter how many times they say it, didn't destroy our banking system. The private sector didn't drive up the price of fuel this summer, and it will go up again because they won't allow the private sector to drill. These people are destructive, and they're power hungry, and they're on the move. And I'll be right back.
Mark Levin.
Let me tell you something, ladies and gentlemen. I've had a heart attack. I have stents in my chest. I've had bypass surgery. I've had 9 angioplasties. I thank God every day for the private health care system in this country. Every single day. Because when your luck is running out, or you're hitting a huge bump in the road, this is the system you want taking care of you. Never forget it. We'll be right back. Mike, San Francisco, California, the great KSFO. Go.
Mark, I'm 27 years old. I pay $400 a month in health insurance. I've had 6 open heart surgeries. What happened today is the first step in a death sentence. Under socialized health care, I will not get coverage. I don't think people understand what is going on here.
Well, first of all, I'm glad are you doing well today?
Doing well. Thank God for medical advancement.
Attaboy. And that's the point, and that's what you're talking about. We're not going to have the research and development. This country, people don't understand, the private sector is so vibrant. It creates so many things. Right now, we don't even know all the millions of things that are going on in our labs, in somebody's garage and so forth, because people are not only motivated by compassion, they're motivated by profit. And this is the way we've understood it in the past. We produce most of the world's medical devices, most of the world's medical procedures, most of the world's medicines. And we do not ration to the extent that countries do that have these centralized, authoritarian, top-down systems like in Britain and Canada and other places, and they escape here to the United States. There will be nowhere for us to escape. And the problem that Mike's talking about is when you're rationing health care, some bureaucrat in a faraway office is going to be making a decision about whether Mike gets that next open heart surgery, or whether Mark gets that next angioplasty, or whether a certain drug is going to be approved even though it goes through all the usual processes, or whether a certain hospital is going to remain open. All these things are going to be decided by a relative handful of quote-unquote experts in faraway places who cannot possibly know what you really need and cannot possibly feel for you because you're just a statistic, and they have budgets, and they have bosses, and whether it's the post office, whether it's the agriculture department, you're going to be treated exactly that way. Mike, God bless you, my friend. I wish you all the health in the world. And I wish all of us good luck. I don't know why you think the government running health care is going to make anything bigger. Because the government running anything makes everything worse. We'll be right back.